Well, Compare-Absorb is a randomized controlled trial, investigator-initiated, in which we randomized Absorb versus science in a high-risk patient population for restenosis. It's a large trial, multi-center, 2,100 patients we wanted to include. Well, first of all, the Compare-Absorb trial is a quite unique trial because it has some specific key features that were not present in previous trials. The first one is that we investigated a population in which we think that BRS technology might benefit the most. We specifically looked at patients that had high risk for restenosis, and those patients have, with metal stents on the long term, not so favorable outcome. So we really aimed at including those, and hopefully BRS will be better in those. Second key feature of the trial is that we started with a PSP protocol from the start. We learned from all the lessons that were taken from the previous trials. So we incorporated that PSP protocol from the start. And third, we also included patient populations that was not investigated previously, like long lesions, CTOs, STEMI patients, bifurcation lesions, these kind of things. Yeah, the findings were, well, initially the primary objective was to look for non-inferiority towards science at 1 year and then look for superiority on the long term. And well, what we're going to present tomorrow is that we show indeed non-inferiority at 1 year. But the trial was prematurely stopped because there was an excess and an increase on stent thrombosis and myocardial infarction in the Absorb arm. Well, that's a very interesting question, and we thought that with incorporating this PSP protocol from the start, we would limit the amount of scaffold thrombosis, but unfortunately that was not the case. They were clustered in the acute phase, mainly in the subacute phase, and unfortunately I think that the problem still arises that we are dealing with a rather thick thread device, and that is limiting, that is maybe causing still early scaffold thrombosis. Does BVS has a future in interventional cardiology? I truly hope so. I'm still a true believer in the concept of BRS. We don't need metal deaths for life, and specifically we see that in metal deaths we see an annual increase on TLF on 2 years, so with neoatherosclerosis and these kind of things. So eventually the best solution would be to get rid of the metal on the long term. However, so far BVS has not shown benefit yet on the long term. But I think we are still too early. We have to be patient. I think we really have to look at outcome beyond 3 or maybe 5 years. And so I'm still hopeful, optimistic, but we have still some hurdles to take.